Welcome everyone to DLA. I'm David Lombardino, and today I have the pleasure to be speaking with Dr. Kendra Outler. Dr.
Yeah.
Outler, how are you doing today?
I'm well. I'm well, David. Thank you. Nice to meet you.
Yeah, nice.
Finally.
Face to face. We've been working with each other for a few years.
Yes.
So Dr. Outler is an anesthesiologist. She's a
Uh-huh.
longtime lecturer on the issue of health disparity in our health care system.
Mhm.
She's going to talk to us about using DLA's editing services, including
Mhm.
for her latest project, her health and wellness magazine, Uzima.
Mhm.
So, Dr. Outler, why don't you tell us a little bit about your background and what brought you to DLA?
Okay. I am a licensed physician, also in the state of Texas, although I live in Washington, D.C. Again, I am a lecturer and a fierce advocate of health, eliminating health disparity, educating my professional outreaches and the community about health equity and health disparity. I even taught at Georgetown, a School of Medicine, a community class for the medical students on this subject. And at that time, I was exploring this conversation after the death of my grandmother in 2011, which I thought was due to basically an inequity situation. She also was rural and poor and Black, and that there seemed to be some difference in her treatment, but I couldn't put my finger on it. So as I started doing the research, and writing, I reached out for an editor, and lo and behold, I found your DLA editors, and I didn't know you were in Houston, and so I went with you because you're in Houston, and that's where I was from, and so I grew up, and so I said, well, they must be good, they must be good, and so and surely you have exceeded my expectations. Now I am, due to the COVID pandemic, I had some time to reflect on that conversation. Again, health disparity. I mean, it was all over MSNBC. And I said, you know what? Let me start writing again, and let's start writing about health disparity, health equity. This conversation that didn't have a perspective that I thought was being missed on the news. So I created essays. And then I said, well, let me call my favorite editor and see if he can help me again. And lo and behold, you and I have now worked, you and your staff and I have now worked on almost 12 essays. They're about 1,200 words, and they address everything during this pandemic that we are seeing: housing, infrastructural, economical changes, chronic disease. So we're continuing to, my Uzima Health and Wellness continue to write about these issues that affect Black communities. And then I just rely on your excellent editing skills by Terry. What's Terry's last name?
Cummings.
Terry Cummings, to basically bring what I'm thinking to life. I love it. Mhm.
That's awesome. And so, kind of going back to that first experience you had of writing, obviously, it was very sad news to hear about what happened to your grandmother. And just to let you know, on our end,
Mhm.
when we were working on that, that was a story that really it not only touched us, but it really shook us and opened our eyes to what certain people may be suffering in
Mhm.
this country that we had previously hadn't been aware of. And so that's something that on our side we really we really take to heart. Anytime clients give, no matter what their product is, we really try to get on board with it. And and that one in particular became kind of a really strong topic for us. Like, hey, let's learn more about this, and we got really excited about working on it for you. I was wanting to know, kind of in that time, like you were going through obviously the grief from your grandmother, and you were starting to write. What is it that made you even think about looking for an editor? And in looking for an editor, what were you looking for?
I'll be honest with you. The first series of writings were again for a lawyer to review the case. And so they asked me to write a summary statement, and I wanted it to be excellent. I'd never written one before. And so I thought I better get an editor to clean this up and make sure it's making sense. So again, I Googled just editors, and DLA came up, and I just said, let's try it, because I just wanted the document to be not filled with emotions and things. I wanted it to be filled with facts, such that the lawyer could understand it. So that was our first relationship, was trying to create these documents. One of the documents you edited, I actually had an opportunity to present to the Department of Health and Human Services. They were very gracious and offered me a face-to-face interview. So again, when you're talking to people in leadership roles in public health, I didn't want to, a document to be filled with layman's language or bad punctuation, because that gets tossed. So it was very important to find an editor. And then, so then again, once you all reviewed one document and I saw how seamless it was, I just wanted to continue to work with you and your group of editors, because what I noticed was that you all were trying to help me, and that's what I loved. You did seem invested in whatever I was sending over.
Yeah, absolutely. And a lot of times, and you mentioned this during our conversation before starting the interview, that one of the things that really stood out to you was that we didn't try to change your voice in any way. What did you mean by that?
Well, I've had other editors before, and before I met you, and they would try to change the tone of what I was trying to say. I was not an English major, but I feel like I can write a good story. I'm very passionate about what I do write. Like I said, I wrote some pieces when I was at UTMB Galveston for the Houston Defender. That's what it is. That's what the paper is called in Houston. So, I know that I can write, and so when I sent it to you all, it was a matter of making sure that the sentence structure was correct. If there was a question, you would put it in the comment section and say this can be worded better, but you didn't try to change the essence of what I was trying to say. And that's the important thing about working with an editor, is that they're not trying to change what you're saying. They're not, if they're deleting a sentence, they are cleaning it up, but they're not taking away from the paragraph so that you can complete your thought.
Yeah, yeah, absolutely. And so let's talk now about Uzima a little bit more.
Mhm.
Who would you say is your audience for that?
Well, my audience is primarily, anyone who wants to be educated on the conversation of health disparity and health equity. I am targeting and trying to make sure that it breaks away the barriers of this conversation, because you're the health equity, health disparity. Again, like when I started working with your company, you were like, whoa, what is she writing? So for a younger audience across races, to have a dialogue. Um, the the audience that spends the most dollars on healthcare, of course, are our older population. So some of the words in conversation may be a little sophisticated for a 20-year-old, but I definitely included them. So we have an audience of primarily, I would like the people that need this information the most, Black Americans, to relate to it. But I also know that in order for us to create a movement and a conversation, it has to embrace all races to bring us, together at the table. So I would say a younger audience from 20 to 50 would appreciate what I'm writing, what I'm putting out on the website. And we want to make sure that it's a multicultural conversation.
Awesome. And so what do you see? I mean, Uzima is something that you've just started within the last several months. What do you see as the next step for? Where would you like for it to go?
Well, Uzima will hopefully be looking at a year anniversary in July. And I have written a monthly essay or editorial. Hopefully, after we do 12, that will be relying on you to help me get the book edited. So there are these various, I call them 12 critical thoughts during COVID. And they were focused on different aspects of the social, economical, and political challenges that we faced during this crisis. We are building some swag, some clothes, hopefully sweatshirts. I'll send you one. This says Uzima. Uh, we want, so we want to brand this idea that we can make a healthier world for everybody. We will continue to put out the online health fair is very popular. And that is that we're talking, this is National Stroke Awareness Month. So we want to continue to push out health online health fair ideas in terms of issues in the community. Stroke awareness, HIV, cervical cancer, prostate cancer. We're going to continue to push out these diseases that overwhelmingly burden Black communities. So that's one thing that we want to continue to do, and just continue to grow the audience.
Awesome. Yeah, it's certainly an exciting project. Looking back over the years, what would you say is the greatest benefit you've gotten from the editing services you received from DLA?
Okay, your service is very seamless. I send it to you at midnight. You get it back to me tomorrow at 11. Okay, that's important because I'm very busy as a physician. I tell people I'm not in a desk. I do go in and take care of patients. So it's amazing that your service can be this punctual when you would say rush or what have you. So that is the reliability of your company is outstanding. Again, I cannot stress how wonderful your staff is. I really don't know how you do it, but you seem to have attracted a very good team that has the same passion, whether I'm getting you as my editor or Terry as my editor. I don't have to worry about the quality of the editing when I get it back. So hats off to your company and your group of editors and what you do. So, what I love about the company, again, is the reliability, the professionalism, and the punctuality, which is very important for me.
Yeah, well, that sounds good. And it's been absolutely a pleasure helping you over the years and and something that we look forward to continuing with you as well. If you were to give one piece of advice to somebody who might be tentative or on the fence about signing up for our services, what would it be?
I would tell them that DLA is the best editing service around. That they should sign up. I think also that your pricing is very reasonable. You can pay. I'm pretty sure whatever for editing, but and let me just add that there are some competitors out here on the web. I think through other companies that shall be nameless that may be cheaper or what have you. I do think your pricing has been very fair. And I think that you deliver more than you get for the price. You can't beat punctuality, passion, and accuracy with the editing. You just can't. So I would tell them to sign up for DLA editing. I would, without hesitation. It really works. You are really that good. Yes.
Yeah, well, thank you very much for sharing your story today.
Okay, thank you.
All right, bye-bye.
Hi, David. Nice to meet you. Tell Terry hi.
Will do.